Hi, I'm Lindsay Frick. I'm the stress management specialist at Goshen Heart and Vascular Center. Managing stress is important because it's not going anywhere. We have to figure out a way to respond to it consciously and actively, and we have to figure out ways to not let it burden us and weigh our lives down. Some common symptoms when we're stressed, we get that furrow in our eyebrows. We're feeling emotions of anxiety and stress that's usually up in the chest. We're really tight around our heart space, our shoulders, and then we get that tension into our neck and down our spine. So those movements of releasing that tension is what you'll find probably most beneficial. Some other symptoms of stress can be the way we treat our loved ones, the way that we treat ourselves. So checking in with that internal narrative, how we're talking to our loved ones, how we're talking to our coworkers, and most importantly, how we're talking to ourselves. In the moment when we're stressful, one of the best things that we can do is to become aware of our breath, using our breath as a tool to calm our body down, to calm down those hormones that spike our nervous system. One thing to remember is that we are not our stress. We are also not the tension that we feel from stress in our muscles and in our body. Those muscle aches that kind of turn into chronic aches and then turn into chronic dis-ease. We are not those things. It's important to disidentify with what we're feeling and remember that we have the opportunity to look at the situation from a different perspective. So often we forget to take care of ourselves. So when we remember to take care of ourselves regularly, it'll show up in the moment as a sense of empowerment and a sense of almost intuitive knowing with what you need to do to handle that situation. Adhering to a daily stress management practice is what's going to give you that calm, clarity, space, balance.
Hi, my name is Connie Dobson. I am the RN clinical coordinator for the cardiopulmonary rehab department at Goshen Health. Both traditional cardiac rehab and the intensive cardiac rehab, more specifically the Ornish Lifestyle Medicine program. I've been with the program a little over a year now, and I'm just very impressed with both programs and how we incorporate stress management in both our traditional and in our intensive cardiac rehab program in particular, the Ornish Lifestyle Medicine program. When we think about, heart disease and heart health, we don't always think about how stress plays a part in how we got where we are with heart disease, and what chronic and acute stress leads to. And so, we think we need medication, we need diet, we need exercise, and those are all great things. And we need the expertise of our physicians in prescribing medical treatment. But there's things that we can do for ourselves, and it's free, and it's called stress management. And before I started in this program, I really didn't think much about what stress was doing to my body. And turns out stress is a very big culprit in heart disease. And other chronic illnesses for that matter. So it's so incredibly important to take care of ourselves in that aspect. And a lot of times women are caregivers, and they don't necessarily want to take care of themselves or even realize that they need to take care of themselves in that aspect. And so that's what we do here in the cardiac rehab program. We really bring in the whole stress management piece. We're going to look at some deep breathing techniques. We're going to do some light stretching, some light yoga, deep relaxation techniques, imagery. So there's so many things that we can do to calm our bodies, to de-stress, and feel better With stress, again, whether it's acute or chronic, there's certain things that our body is going to let us know that we are feeling stress. We have this, our bodies are amazing. And we have this autonomic nervous system. And so you've heard of the fight or flight, and that's our sympathetic nervous system going to work. And it's a good thing that we have that because we need it. But what that does is it increases our heart rate, increases our blood pressure. It actually, our bodies then release stress hormones, the adrenaline, the cortisol. So those hormones are flowing through our body and changing our body. I mean, when our blood pressure is getting elevated because our vessels are constricting, our muscles are constricting. We are in that fight or flight mode. And so then our body, just the same, can also release the parasympathetic nervous system, which actually kind of helps calm us. And so, doing those deep breathing techniques will decrease your heart rate, decrease your blood pressure because it's opening up those vessels. When we're doing deep breathing exercises and mindfulness and centering, all kind of help calm the body and act much like the parasympathetic nervous system. And so those are kind of some of the symptoms that you will see, and how the deep breathing and centering yourself and relaxing your muscles really helps with that. When we do some stretching in class, the light stretching, really kind of opening up your chest space to allow for blood flow, to allow to expand your lungs. All of those things are helping your body to calm down that adrenaline and those cortisol levels. Again, our stress can also affect our bodies indirectly as well. And some of the ways that it does that is, we're feeling stress, we feel like we need to calm ourselves in other ways. And so sometimes it leads to overeating. It leads to alcohol. It leads to smoking. And so sometimes it can be a bit of a vicious cycle because we're not handling our stress the best way. And we're in fact increasing our risk factors for cardiac, for heart disease. So those are just some of the ways that we see how stress can affect us directly and indirectly. I always suggest, if you've not tried yoga, try yoga. It's an excellent way to de-stress your body and exercise at the same time. Right off the bat, what comes to mind, when you see a loved one in a stressful situation, or you see it in their face, something that you can do in the moment is again, taking a step back, take a deep breath. If you feel like just recently I had a situation. It doesn't happen to me very often, but I was I was actually at the store, and there were people, there was somebody that kind of cut in line, and, normally that wouldn't bother me, but the line was very long and I was anxious and I wanted to get out of there. But I felt that whole heart rate. I could feel my heart pumping, and I felt like I needed to say something. And so in that moment, I just kind of took a step back. I tried to reset my mind with positive thoughts. And because, when you're in that moment, and that negativity starts to take over, it is almost like a vicious cycle. And so what I did was kind of take a step back, take a deep breath, and then I just took my mind to something more positive. And, you know, at the end of the day, is my time, is it worth it? Is it worth it? Or is this okay that I'm waiting? And then I just had to be okay with it. And so practicing mindfulness, practicing gratitude is incredibly helpful. I've been a nurse for nearly 20 years. And so as a nurse, I've been in some very high stress situations. And quite honestly, I wish I would have known way back when what I know now, because I probably would have handled things much differently. But what this has taught me is that, you know, this program is that there are things that we can do in when we are in stressful situations, whether it be with our job, whether it be with family, that we can help ourselves to feel better and not carry that stress, that burden, and practice again, like I said, the deep breathing. I go back to that because it's so incredibly important. When you're doing deep breathing techniques, you are actually working your vagus nerve and your vagal tone, and working that vagal tone, having a strong vagal tone with deep breathing techniques. It helps you again decrease your heart rate. You can actually, with all of these fun little, you know, I've got my little watch here that I can check my heart rate at any time. And I will do deep breathing techniques and I can watch my heart rate drop as I'm doing it. So increasing that vagal tone is so important for the body. You know, just centering yourself first, kind of mindful to just kind of release all of your muscles, the muscles in your face, just kind of let yourself calm for a minute, and then taking in a deep diaphragmatic breath in, and then on the out breath, you want to release and let that breath out, and count to 7, count to 10. So the longer you can let that breath out, that's what you're kind of striving for. So those really mindful in and then long out breath. So those are some of the things that we practice with the deep breathing.